So we're going to show you 3 tips that you can do, exercise that you can do to help with your back pain while sitting. Back pain is one of the leading causes of disability in the U.S., costing over $250 billion in the United States alone. And it's one of the most mismanaged areas of the body. We see this all the time. We help clients all the time avoid surgeries, injections, and medications. And so we often get questions like, what can I do in my chair? How can I get my chair in a situation that's going to help me when I'm working? Because let's face it, what do we do throughout the day? We're almost always sitting, typing on the computer, working. Most of us have sitting jobs, which leads to a lot of disability with back pain. It's one of the main reasons that we have issues is because we sit. And why does that happen? Well, when we sit, like if this is our back, and these are our discs that's in between here with our spine, and you have your nerves coming off to the side. A lot of times when we sit, we end up sitting slouched. So we'll slouch in the chair and we'll work. And when that happens, it's like you're putting pressure on the disc, hanging out here for like 8 hours out of the day. And that puts pressure on the disc, which moves everything to the back, which is where our nerves are. You end up having issues within the rings around the discs that can produce pain and refer pain into our hip or our back or down our leg. You can press up against the nerves when here. And so this is one of the common things that happens is because we're sitting all the time. And even if we're not sitting, then we go home and sit on the couch, or we go and clean and we're always bending forward. We never go in and take our joints in the opposite direction, because when we do, and we go back this direction, it ends up giving us some pressure, takes some pressure off the disc, off the nerves, and moves everything away. Now, there's a lot of other things that can happen that can produce back pain. We also know that the thoracic spine, those lower ribs can produce pain in the back. We also know that the hips can produce pain in the back. So it's not always just the back is the main issue, but a lot of times it is. And these are some great exercises that you can do while in your chair. So the first one, the biggest one is like when we sit, and if we're going to sit a lot, we want to make sure that we're in a good posture, because when we stand, we have this natural curve in our back. But what happens is we slouch, and that actually flexes the spine and the lower back. So we want something to kind of help maintain that curve. These are lumbar rolls. They're fantastic. And literally what you want to do is you want to sit your bottom all the way to the back of the chair. You can use something like this. They're very easy to find on Amazon. Or you can roll up some towels and put a rubber band around it. Then you're going to place it in the lower part of the back. And now I'm able to rest, and I have some support through that little bit of a curve that we have. It's also going to help me up here, because if I'm slouching in my back, look what happens to to my neck, my shoulders, everything starts slouching. But if we can put this in the back, it's going to help us maintain a good spine position without us having to hold that position. It's really hard to hold. So now when I'm typing on the computer or doing anything, I'm in a much better position. So that's the first thing that you can do to start getting you some relief. Now, we often say, take some breaks. And so you can take some breaks. And when you take some breaks, we can do things where we call where we kind of move our pelvis forward and move our pelvis backwards. Just getting it to kind of move. Our body likes motion. We say motion is lotion. Our joints are meant to move. It's usually why we feel better when we move, because our joints are meant to move. But when we're in these static positions for long periods of time, things will stiffen up. So you can just take your pelvis, rotate it forward, kind of arch the back, roll it behind, arch the back again. So you can kind of do these. Go and put yourself on a timer for about a minute, and then go back in and start working again. The last one I want to show you. Now, this one you're going to need a chair that's a little bit firm, which is why I picked this chair to begin with. So you can find a chair that might have a low back like this. So this has, it's low, it's pretty firm. You can also put a pillow over something like this, and you're going to sit on it. And you're going to have your hands behind your head, and you're just going to kind of arch back and then come forward. So this kind of will work on those lower ribs a little bit. Again, we get rounded through here, because if I'm going to work on a computer, you can see where I'll round right in through here. So you can kind of stretch this area in your chair to kind of go backwards and then kind of coming up and then going backwards. So I'd say like doing 10, 15 of those every day. The anterior, posterior pelvic tilts, you just want to move. Every couple of hours, you can just, or like whenever the phone rings and you're talking to someone, you can just kind of move your pelvis back and forth. So you're just getting used to your body moving, because again, our body loves to move. And then using the lumbar roll to really help keep you in that better position while we're in that static place. So if you do these 3 things, you should start noticing that you get some relief with your back pain that you're having. If you don't, there's going to be other things that you can do to help improve your motion in the back. So my name is Stephanie. I'm with Empower Physical Therapy. If you like what you hear, make sure you like our channel, subscribe, like the video, subscribe to the channel. We have other resources for you in the description where we have some free reports on back pain, some other back pain resources that you can look into. So make sure you check that out as well.